There we go. Good morning, everyone. Welcome to this webinar, free webinar by Prevention Plus Wellness, LLC, located here in beautiful Jacksonville, Florida. Thanks for joining us from where you're at, somewhere across the country, East Coast, West Coast. We may have some people from abroad as well. We get quite a bit of interest in our webinars, and that's awesome. I mean, it's just a real blessing for us to have the opportunity to interact with you, prevention and health, fitness, and other specialists from around the world, and to learn what you're doing and to support you any way we can. So we're happy to do it. It's certainly our mission, and it's an awesome mission. So just coming off the CADCA conference that was in DC a couple weeks ago, met quite a few people, and we may have some of you that I met there for the first time and are joining us. Welcome. And we just had a couple of days ago the 8th annual Tampa Substance Abuse Prevention Summit in Tampa, Florida. Met some people there. Maybe they'll be on today as well. And we'll also be traveling to, Westminster, Colorado in April for the Blueprints for Healthy Youth Development conference. They have a conference every other year. If you've not been there or you want to learn more about evidence-based prevention and other types of programs for youth and youth development, check out Blueprints for Healthy Youth Development. They have a registry of evidence-based programs that also include our sport prevention plus wellness for youth and In Shape prevention plus wellness for young adults. But today, I welcome you to this session. We are recording this. This will last between 30-40 minutes, excuse me, 30-40 minutes, and then I will open it up to Q&A. So if you have any questions as we go along, if you do have access to your live chat, you're welcome to type that in as we go, or you can wait till the end. But I do want to hear if you have any questions or comments. If I could help in any way, I'm happy to stay as long as you want to stay to interact about today's topic: evidence-based prevention plus wellness implementer, training of trainer, and youth training opportunities through prevention plus wellness. So today's session has 3 objectives. The first is to describe PPW, that stands for Prevention Plus Wellness, Program Implementer Training, aims and options and costs for professionals like yourselves. Secondly, you'll be able to detail PPW Training of Trainer workshop benefits, of which there are a number, as well as their options and costs for you if you are interested in training of trainer workshops that we offer. And thirdly, to explain youth leadership training in prevention plus wellness in terms of its aims, options, and costs. Now, I think the last free webinar we had a week or two ago was specifically on youth leadership training. So if you were on that, this will be a little bit of a review for you. But stay till the end, because we do have some free resources I want to highlight and share with you from our website, preventionpluswellness.com. If you haven't been to it, I highly recommend you go check it out. Now, before we begin talking about the training we offer here at Prevention Plus Wellness, we need to look at the programs about which we conduct the training. And the 2 evidence-based programs, the first one we'll talk about is Sport Prevention Plus Wellness. And as I said, this is evidence-based. And when I say evidence-based, because there are some differences in terminology, evidence-based should mean, for the most part, and I think it does mean, that this practice or program has undergone rigorous evaluation, and generally those results, which are positive in nature, are published in a peer-reviewed scientific journal. So there's 1 or more studies, they're published in refereed journal articles, and then, and only then, can they be or should they be listed on evidence-based registries. And by the way, our sport and In Shape prevention plus wellness programs are listed on a whole array of evidence-based registries, including, as I mentioned earlier, Blueprints for Healthy Youth Development but you can learn all about the registries that list our sport and in shape PPW programs on our website. So sport, to go back to that, evidence-based, proven to prevent alcohol, tobacco, and cannabis, as well as increase physical activity among non-using and substance-using youth. And this is all done within a single intervention that targets the promotion of physical activity, healthy nutrition and breakfast, sleep, and to a certain extent, stress control. A single 45-minute session, screening and brief intervention, and there are versions of sport for high school, middle school, and elementary school. You implement the sport program with slides, which highlight those positive desired images that promote and that increase motivation for change. And then you capitalize on that by having them, young people, begin that change process with setting goals to avoid substance use and by promoting one or more protective wellness habits. You have in your sport physical manual scripts to implement it individually, one-on-one with youth, all youth, high-risk youth, as well as in a group setting. So it's very, very flexible. And it's based on marketing theory, the behavior image model. We've discussed that in some of our earlier webinars. We'll discuss them in the future. The behavior image model is the conceptual model upon which prevention plus wellness programs are based, but there are other theoretical models and constructs that support prevention plus wellness programs. There's, as I mentioned, marketing theory, positive images underlying our models, optional parent materials, a letter to parents, and 4 weekly flyers that can be mailed out, handed out, sent out, emailed out, posted on your website. That's an additional optional intervention all by itself. You can use it as a follow-up, trying to get parents to provide that same positive image and behavior communication that you might provide through the use of the scripts in the sport prevention plus wellness program. And in addition to your manual, you get all the reproducible materials in a digital download, the PowerPoint slides, the screening surveys, the goal plans, the flyers to the parents. Everything is in a download. You copy it to computer. So once you have your manual, you can literally implement your program to dozens, hundreds, thousands, billions of young people if you want to. It's yours, and you don't need to purchase anything else. One-time purchase. So it's a great cost-effective program. Another evidence-based program that we offer is In Shape Prevention Plus Wellness. This is a parallel program to sport for young people, high school, middle school, elementary school, In Shape for young adults, could be college, community. We have U.S. Air Force implementing In Shape and adaptation of it. Also evidence-based, proven to prevent alcohol, cannabis, and drinking and driving while increasing physical activity, sleep, and health-related quality of life among young people. And like sport, it targets physical activity, healthy nutrition, sleep, and a little bit more content on stress control. Again, a single session, a little bit longer, I'd say about 50, 55 minutes in length. Screening and brief intervention. And by the way, screening and brief interventions are an evidence-based practice according to SAMHSA, the Substance Abuse Mental Health Services Administration. So screening and brief intervention is a practice. A practice is above a specific program. So we have Sport and In Shape, evidence-based programs, but they are also screening and brief interventions, and therefore they are evidence-based practices. So keep that in mind when you promote these programs or ask for funding. Again, number 4, implemented with slides. Number 5, scripted scripts or protocols to implement it one-on-one or in a group based on a behavior image model and focusing on positive images that increase desire, motivation for change, and reproducible download so you can implement it to many, many young people, as many as you want. We also have, in addition to those 2 evidence-based programs, what we call evidence-informed programs. They're based on sport. They're based on the behavior image model. They're based on the screening and brief intervention as an evidence-based practice, but they have not been evaluated specifically. But nonetheless, they have the same content to a certain extent, to a large extent, same strategy, screen, feedback, goal setting, targeting physical activity, healthy eating, sleep, stress control, single session, and on and on. So you can look at the list from 1 to 7. And you can see in the far right hand column, those are the evidence-informed programs that we offer. Vaping prevention plus wellness programs, not very many programs out there addressing vaping. And this is a great one, single session. You can get in there and provide that to almost all youth. The beauty of the screening and brief intervention, the PPW programs, is that because they're a single session, you can use them with any other prevention or education or fitness or even intervention or treatment program. But by using these single session prevention plus wellness programs, you could reach all youth. You can't get into a school necessarily and provide an 8 or 10 or 12 or 15 lesson evidence-based program. You'll only reach a certain percentage, even if you can get in the school. But with sport program or In Shape, because it's so brief and impactful, you could provide it to all youth. So you could really have a very broad public health effect. Even if it's just a small effect across the whole population, it will have a significant public health positive outcome on youth. They get those prevention and wellness messages out there. So you're not just promoting prevention of substance use, you're promoting the increase of protective wellness behaviors, physical activity, nutrition, sleep, stress control. And that's the opposite side of the coin of those chronic disease risks. Not enough physical activity, not eating a breakfast regularly, not eating enough fruits and vegetables, not getting 8 or more hours of sleep, not controlling daily stress. And by the way, most youth experience these chronic diseases, risks, factors, in physical inactivity, poor nutrition, inadequate sleep, and so on. So great programs, vaping prevention plus wellness, marijuana prevention plus wellness, if you want to address those specific messages, opioid prevention plus wellness. Sport 2 PPW is our only multi-session program at 6 sessions. So if you want to provide more content, you can provide sport, and you can provide sport 2. So you can actually have 7 lessons or anywhere from 1 to 7 lessons. And in God's Image is our completely downloadable, very inexpensive faith-based program that integrates not just avoidance of substance use and promotion of physical health habits, but also the promotion of spiritual behaviors as well. It's a great, great program. So all of these programs are available, both evidence-based, evidence-informed, all of them founded on the evidence-based screening and brief intervention practices. Now, let's get into it, talk about training options. You've got 4. First of all, you don't have to do training. If you don't want to do training, fine. You've got step-by-step instructions in your program manual that you order. You can just follow those. We've got content on our website, preventionpluswellness.com, to help you get through it. But in our experience of having these programs implemented in all 50 states and across other countries, we have found that training is invaluable. It's brief, it's not very costly, there's really no excuse not to get it. Even if you're very talented and experienced, we highly recommend the training so that you learn how to implement this evidence-based and evidence-informed programs with fidelity and maximize its effectiveness. So no training is an option, don't recommend it. Secondly, you can receive training as a program implementer. Thirdly, as a training of trainer, where you train other program implementers, whether those are other professionals, health education or sport or prevention or education or whatever. You could train those other professionals to implement PPW programs, or you could also train youth to implement it as a youth leadership experience. And that's number 4, youth leadership experience training as a PPW program implementer. Let's look at the training descriptions and options. These are the workshop goals, generally speaking, for training. The first is that you will learn, if you receive training in PPW, programs, you'll learn to describe the need for prevention plus wellness. These kinds of programs that address multiple health risks of youth and young adults by the integration of wellness promotion with substance use prevention. Secondly, you'll identify how to effectively implement your PPW program or programs. Third, you'll develop knowledge, skills, and confidence to implement, or in some cases, train others to implement the evidence-based sport or in shape or one of the other prevention plus wellness programs we listed, whether it's vaping or marijuana or opioid, in God's image, what have you. And lastly, you'll learn to discuss how to monitor the quality and outcomes of your program, as well as how to extend and sustain your program at time. Now, there's two items there. The first item is how to monitor the quality and outcomes. That's because all of our programs include built-in pre and post-test screen. I would say they're either online or scannable forms before and after your one lesson. So if you collect those from your youth and you send them to us, then we will do a free analysis so you can see exactly how you do at your site, or you as a implementer, how you're doing, and you'll get the data necessary to continue to promote and market your program, as well as to improve it over time. And then we do have a bunch of resources on our website if you want to build upon that single session intervention and do more with your youth, more with parents, more ideas for you. We have lots and lots of free resources on the website. Let's take a look at the online prevention plus wellness training workshops. We have, first of all, the first level is a program implementer training. This consists of 1 hour recorded core knowledge. We have that posted on our website, and actually anybody and everybody can have access to it. So you have the free 1 hour core knowledge, but we also have a 2 hours live workshop where we'll walk you through the scripts, the protocols, step by step, how to implement it. So you get introduced to how to provide your program, how you can tailor it if you want to your setting or population, how you can evaluate your program, how you can enhance or extend your program if you want to. And then you have 2 hours on your own in practice. So 5 hours total training. We give you a certificate. You have a 3-year certificate as a PPW program implementer after that 2 hours live workshop. Also, training the trainer workshop is 2 hours live, and we can do that online or on site. And the prerequisites to that is you have to first complete the program implementer training and then implement your PPW program at least one time. But if you get training as a program implementer, you implement your program one time, then you're eligible for the 2 hour live training of trainer workshop. Ordering online training. It's very simple. You can do it off from our website. Typically, our training online is offered Tuesday through Thursday each week, 11:30 Eastern time to 8:30 Pacific time. It runs 2 hours, as I said. If we have 2 or more individuals from the same organization, they could select just about any day and time for the training. What you do is you select your program type and date from a list on our schedule under preventionpluswellness.com. You go to training, and then there's a link to training schedule. You'll see the schedule. Number 5, you just email us the number of attendees that want to attend that particular date and type of training and program training. And then you purchase your training online. So we'll send everybody who's attending today's session a link to the recorded training, but we'll send you, more importantly, a PDF of this so you can actually click on that link to purchase, but you can also just go to preventionpluswellness.com and find it. The technical requirements for online training. And we have not had too many problems with this recently, so I think everybody's good with it. They're used to having webinars, but you do need a device with either a wired internet connection or a strong Wi-Fi signal. You need a device with a built-in or add-on microphone so we can hear you. So this kind of a training is not a webinar. You're not just listening like here. I'm able to hear you, you're able to hear me, so we can have much more conversation during the training. Thirdly, you use a device with a built-in or add-on camera so we can see you. I could see you, you could see me. It's much more of a conferencing strategy, and it brings it much more in line with the face-to-face kind of training. And lastly, it's best to use a headset. Right now, see, I'm using a little earplugs, and it's got a little microphone right here. And it's best to have that because then you don't hear the fact that my dogs are in the other room barking. And I don't know if you heard just a few minutes ago, someone was mowing the yard out there. So this really cuts down on using these earbuds or a headset, cut down on the background noise. But if you don't have that, we could work around that. So that's not a major problem. And let's now shift to on-site training for program implementers and training of trainers. So a program implementer on-site training, we have the 1 hour recorded core knowledge that's necessary, key information there about the theory, the research, etc. But then when we have an on-site training, we extend it to 4 or 5 hours to make sure people have a chance to practice. So they get to practice during that on-site kind of a training. The on-site training is I or somebody with our company will come to you, or a trainer that's been trained in your region will come to you, or you can go to them. Much more realistic to have that. And a lot of people, or at least some people, love to have that face-to-face training. There are certainly benefits to the face-to-face training, and there's benefits to the online training as well. The on-site train the trainer, 2 hours. A live workshop, and it's interesting is we can actually hold a program implementer training followed by the train the trainer in 1 day. So it'd be a full day, a full 7 hours, 8 hours, but we could do it all very convenient. So normally what happens if we do that, we'll have a larger group, everybody gets trained as an implementer, and then there's usually a subset that want to be trained as a trainer, and they'll stay on for another couple of hours. And then you implement your program one time, and you're certified as a trainer, and you're certified for 3 years to implement, train others to implement that prevention plus wellness program. So what are the TOT options? And TOT stands for Training of Trainer. TOT allows the training of other prevention plus wellness program implementers, and that could be in your organization if you have turnover, and I think that's a given nowadays, particularly in our fields. So train in your organization so you don't have to pay for us to train anymore, or during those 3 years that you're certified. You could train in your region if you want to have a larger impact and really spread the impact of your prevention plus wellness programs. Or it could even be within the whole state or even a small nation. We have some islands using our program. So that's the first part. The second point is that TOTS, that's Training of Trainers, can provide a prevention plus wellness program implementer workshops to other prevention and health specialists. TOTS can also provide youth leadership training workshops. This is where a Training of Trainer trains young people in youth leadership and youth groups, at any of those kinds of settings, to serve as a implementer of the evidence-based or evidence-informed program. So it's a great leadership experience. I'll talk more about that. And they could, young people could then implement the PPW program to their same age or younger age peers. And lastly, TOTS can serve as PPW training consultants. We do on occasion have consultants that they're more independent and they want to work to help. They are invested in prevention plus wellness programs. They feel that it's a great model and great programs, and they want to be involved in spreading it more broadly outside their organization. And we bring them in as consultants, and they receive training fees for their training. So all of those are options. Program implementer requirements. There are no requirements for program implementers. We do highly recommend you get training, but we don't require people to get training. So we're not going to twist your arm if you absolutely can't or don't want to have the training. And we do try to support you. We have support throughout your use of your program, throughout the life of your program. As long as I'm living, you'll get support. And anytime you need help while you use your program, I'm happy to provide you with support so that you're successful, your kids have success, and we have a significant impact in your communities, schools, region, state. PPW programs can and have been implemented by a wide variety of professionals and youth. And so, for example, school and college teachers, coaches, prevention specialists, healthcare providers. You can see the list: mental health professionals, juvenile justice professionals, sports, recreation, and fitness specialists, youth and peer leaders and mentors and military personnel, faith-based youth leaders, and parents. And just about anybody can be trained. No requirements, prerequisites to become trained as an implementer. Program implementer and training costs. Some of you, I'm sure, will be interested in knowing this. You can find this on our website, but I'll go over it very quickly with you. Program manuals and the digital downloads are $4.99. Once you order that, you got your manual, got your digital download. That's all you need. You're off and running. You don't need to purchase any more materials, not for your kids, not for teachers. That's it, one-time shot. If you want your online program implementer training, it's $199. That's a 2-hour live training. And so that's all you need to do for an investment for your program, and you can start implementing it to countless young people. Online TOT workshops are $349. On-site program implementer workshops are $1,200 per group plus travel. So that's a pretty reasonable price compared to other evidence-based and non-evidence-based programs, actually. So you could have a group of 10, 20, even a little bit larger group, and for $1,200 with travel. If it's me, and you're on the West Coast, maybe it costs a little bit more. For the East Coast, less. If we have somebody trained as a trainer, you could have very little, if any, travel costs. So it can be a very effective, efficient way for you to get your on-site training. And then we do have on-site training of trainers for $349, and I'm the one that does that. You could also host a training workshop for your organization or region. Host organizations get free program materials and training. And you could train in evidence-based programs, Sport and In Shape, or evidence-informed programs, vaping, marijuana, opioids, In God's Image, Sport 2. But we invite partners to hold on-site training workshops with us, to work with us. Now, what are the benefits for you if you host a training in prevention plus wellness programs? You showcase your leadership in evidence-based programs in substance use prevention and wellness. You get the latest PPW programs and digital downloads. You can include training of trainer, a workshop component to that. That's that extra 2 hours. You get 3-hour certification. Everyone does who attends. And you could expand your prevention reach to nearly all youth, because the majority of prevention plus wellness programs are just a single lesson. You can get them into those very busy schools, boys and girls clubs, YMCAs, whatever setting, clinics, hospitals, almost anywhere. You can find a way to get that single session program so critically important for youth and young adults. Program and training licenses we offer. The idea here is to have a larger agency or organization at the state level, national level, whatever, or a foundation that has the resources to work with us to do set up a license, so that we can get the programs and training to all people in a large region or state or nation, and then those at the lower levels that don't have the resources get the benefits. So this is very cost effective for expanding your reach of programs and training. Yeah, we can provide PPW programs and training throughout a large area, region, state, even national licenses, and we'll tailor the licenses to your needs, the program type you want, or types, online or on-site training, a program implementer, TOT training, youth leadership training. All of those are an option, and we work with whatever. So if you have an agency at a state level, talk to them, see if they might work with us to do a license, so that all of you can get your training in your programs. Now, let's take a look at youth leadership training, youth leadership training options, online or on site, practical 2 hours live, 1 hour recorded, and in practice, same strategy for youth as it is for professionals. Young people develop knowledge, skills, and confidence to implement Prevention Plus Wellness program. They learn how to implement an evidence-based program as a young person. It's a great hands-on service and leadership experience. And it's $499 for 50 youth and adult mentors. So it's less expensive because we want to get as many young people and their mentors trained. The program materials include a booklet with the group script is usually what young people use. They'll implement it to their peers in a group setting, but we can also send you a one-on-one script if you want to order that. You get a digital download of reproducible materials that includes a screening survey, goal plans, PowerPoint slides, pre-post survey, so young people, the youth leaders can actually learn how to do a pre-post assessment. It also includes process evaluation tools, online resources, and the costs are $199 for a set of program materials for 10 youth. So it's a reduced price, and we can reduce it even more if you have a large group of youth. Now, what are the settings? Populations in leadership roles possible in youth leadership training and prevention plus wellness. Well, settings include colleges. It's very common to have peer trainers in colleges. We do schools, train high school, middle school. We train like high school junior seniors to implement it to freshman, sophomore, and all kinds of options there. It can be implemented, youth can be trained and implemented in youth clubs and groups, faith-based settings. Same age or younger age peers are the recipients. And the leadership roles are tailored by age, maturity, ability, and interest. So not everybody has to implement this lesson to their peers, one-on-one or in a group, but there's a lot of experiential things that take place. Practicing the scripts, program tailoring, people can choose to be involved in that. Planning and preparation for implementation, pilot testing, presentation. Some young people will be presenting the content, data collection, data analysis reporting, communicating findings, marketing the program, and making changes based on findings. So there's a range of activities that trained youth can participate in. Not everybody has to be the presenters of the content. And the objectives of the training are a number of objectives, 6 of them, for young people to examine evidence-based and evidence-informed prevention plus wellness programs, list differences between typical substance use prevention programs and PPW interventions, explore theory and research supporting brief and multi-health behavior screening and brief interventions, describe option setting steps and adaptations for implementing and evaluating prevention plus wellness programs. Of course, the core objective is to develop knowledge, skills, and confidence to implement this prevention plus wellness program. And then lastly, describe how to monitor quality and outcomes from your PPW program. So in conclusion, let me see where I'm at, just a little bit over time. PPW Program Implementer Training is available on-site or online, provides prevention and health specialists with skills to provide evidence-based and evidence-informed prevention plus wellness programs. That's 2 hours in length live. Then there's a 2-hour live PPW Training of Trainer that can provide it online or on site. Provides prevention and health specialists with skills to train other professionals or youth leaders to implement the 45-minute PPW programs. And then there's youth leadership training, which provides young people with hands-on service and leadership experience to implement PPW programs to same or younger age peers. So they could implement sport programs. They want to learn evidence-based program. Maybe vaping is an issue in their school, as it is throughout the country. They want to learn about vaping and about evidence-informed program, implement that in their school. So it's a great, great opportunity to train youth to provide these programs. And because they're scripted in a single session, very practical for young people, where you can't have youth leaders provide evidence-based programs that are 15 sessions in length. Here's some resources for you. Again, I'll send you a PDF of this so you can find these. You can find them actually on our website, preventionpluswellness.com. But we do have on our website an introduction to Prevention Plus Wellness core knowledge. That's that 1-hour recorded session. Really good content, necessary for all implementers. of programs, but if you're just interested to learn more about PPW programs, you could view that. Number 2, PPW Youth and Teacher resources, tons of resources there, and I won't go over that right now. I'll let you explore that on your own, as well as healthy lifestyle guidelines for youth and young adult goal setting. Very, very popular link of evidence-informed content for number 2 as well. And lastly, we have sample grant proposals for those of you wanting PPW funding, and then there's a bunch of other free materials on our website. I highly recommend you go to preventionpluswellness.com, plug in your email, and then you'll be caught up to date, because we'll send you weekly email blasts to let you know about all the blogs, all the news items, any special deals, the free webinars we provide, and all the other good stuff we try to do. That's our website, preventionpluswellness.com. And if you need our help, you have any questions, you can go to PPW, preventionpluswellness.com, not PPW, preventionpluswellness.com, it's all spelled out. Or you can call us here in Jacksonville, Florida, 904-472-5022, or you can email us at info@preventionpluswellness.com. Thank you so much for attending. I'm going to stop at this point and see if anyone has any questions. I'll just stay here as long as you want me to stay. If you have any comments, any questions, anything that was confusing, anything you want to ask about our online or on-site training of implementers, training of trainers, or training for youth leaders in any of our programs, online, on-site, let me know right now. I'll give you a couple minutes to see if there are any questions. Anybody wants to type in a question, they can do that in the chat space, or there's also this other little space over there to the right. And let's see. Nothing. Nobody has any questions. Oh, here we go. Here's something. Let's see. Do you know if Prevention Plus Wellness is a vendor with My Florida Marketplace for Florida state agencies? No, it is not. But if you feel that that's important, so that you could access it or get funding for it, shoot me an email at info@preventionpluswellness.com. Maybe you could share a link to that, or you could just pick up a phone and give me a call. I'd really like to know what you're thinking of there. Is that something that's necessary, or is that something that's just good? Because all states have, these marketplaces, and you could spend a lot of time getting listed on those, and we have not done that to date. So let me know what you think. If that's important for you, if it helps you, then we'll likely look into that and see what's required. So if it helps you get training or get program materials, we'll be interested in it. If it's a factor to just get the word out, that's also important for us. And so let me know what you think. But thank you for bringing that up. We have looked at that in the past, but have not taken action on that at this point. And then I am with the Department of Health in Florida. The $4.99 online costs cover one person or group. So the $4.99 is the manual. The $1.99 is the program implementer training cost. So it's really those two things combined. So if you wanted a manual, $4.99, it comes with the manual digital download. If you want the program implementer training online for 2 hours live, it's $1.99. So we have separated those out because we do have some people, we don't want to force people to take the training, but we do highly, highly encourage it because we have found it to be very, very effective and important to understanding and providing the program. Just providing it without training, you're sort of left to your own devices. And even if you're very, very highly skilled and experienced, it still helps to have somebody, walk you through the program and to share best practices that we've learned from, we're going on 11 years now providing these programs throughout the country and world. And we've learned a lot from people that have implemented them and organizations that have implemented them in just about any setting. So So that's the training. Now, again, the training for youth is less expensive for $4.99. That's 50 youth that are trained, and then the program materials I think are $199, or what did I say? $199 for 10 youth, I guess. I think they're $20, the little booklet. So, but we're happy to work with you on pricing if that's an issue, especially if you buy multiple booklets or multiple manuals or multiple training. We're happy to do what we can to make sure everybody who wants to use these very, very practical and powerful programs are able to do it. So we'll do whatever we can to make sure that you get your programs and implement them with success. So you only need one manual, and then you can have as many participants as you want with that. Or do you need one manual per person who takes the course? So that's thank you for that. And I should have picked up on that the first time you asked it. So you can have one manual, and the manual, the digital download allows that person or that organization to implement it to as many people as they want. You're welcome to share the manual, but you cannot copy the manual. It's copyright covered. It even has in there, don't copy. So it's ideal for all your implementers to have their own manual. If you need to save resources, if you don't have the resources, then you could share a manual. But if you're going to be implementing the program, let's say sport, at the same time, then, and you have two people, then obviously sharing becomes an issue, becomes a problem. So each individual that implements it should have their own manual. You need the manual, but again, if you have a budget issue, if you got limited budget funding as well as everybody does, then we do have organizations that do share the manual, and if that's practical for your setting. So it all depends on the setting. But again, if you're going to order multiple manuals, we're happy to work with pricing with you if that becomes an issue. So, but you can have one person order manual, order their training, and that's a training per person as well. So it'd really be, if you want, and you had two people, you'd order two manuals and you'd order two trainings. So, but again, call me, contact me, email me, info@preventionpluswellness.com if funding is an issue for you, if you want to just roll it out or start it as a pilot test, which a lot of organizations will do. They don't have a lot of funding. They'll try it as a pilot test. They'll order a couple of manuals and a couple of trainings, or maybe even one manual and training. They'll see how it works. They'll get excited about it, and then they'll go for some more funding, and then they'll roll it out on a larger scale basis. Or sometimes organizations will start with one of our programs. Let's say the evidence-based sport. They love it, but most of the messages in sport address alcohol. Even though the outcomes included alcohol, tobacco, and cannabis, they maybe want to address cannabis or vaping or opioids separately, so then they'll go ahead and order the vaping prevention plus wellness program, or opioid prevention plus wellness, cannabis prevention, marijuana prevention plus wellness, and so on. So we have a lot of options, or different options for your organizations and for your youth, depending on your needs in your area, your arena. Awesome questions. Let me see. So any other questions or comments? Those were great questions. Thanks for raising those. Thanks for forcing me to clarify everything for everybody. I'm sure it's clearer now than it was when I first was talking about it. So the sport 2 6-session includes what drug prevention topics? Okay, great question as well. So let me just back up and say the original sport addressed primarily alcohol, because alcohol has been and will continue to be for the foreseeable future the most prevalent substance use among young people. And so what we've done over time is we've addressed in the original sport, we've expanded some of the messages, but mostly the goal setting, the contract to mention other substances, not just alcohol, but tobacco, e-cigarettes, marijuana, prescription drug misuse. So we do mention those other substances. And then keep in mind, the original sport program, which just addressed alcohol, had significant impacts in reducing and preventing alcohol and tobacco and cannabis. So then some organizations like to have more content. So Sport 2 has 6 sessions. So whereas the original Sport condenses and addresses these interactions of wellness behaviors, how they affect substance use and vice versa, and also your desired image of yourself in the future, Sport 2 separates out those behaviors. So Sport 2 addresses 3 sessions on different types of physical activity, moderate, vigorous, and muscle strengthening, 2 messages on nutrition, and 1 message on stress control. But I think most of the substance use messages, if I would have to look, certainly alcohol is mentioned, but I think there's a little bit broader content there. So whether it is mentioned or not, our research indicates that young people draw parallels between just saying alcohol interferes with you being physically active, fit, and successful, interferes with your healthy nutrition and sleep, interferes with your controlling your daily stress. And so they're able to draw, whether it's explicit saying, here's how vaping interferes, or you just say, here's how alcohol interferes. Young people appear to be just fine with being able to draw the parallels between, oh yeah, I know it's not just alcohol, it's vaping, it's marijuana, it's opioids, also can interfere with those positive behaviors and images and lifestyle. And it's not necessary to draw those distinctions with every single substance. But if you want to address other substances, then you can do that with the vaping, marijuana, opioid. And here's the other thing I'll say. If you want us to develop for your state or your region or large organization a 6-session program that addresses, as you were saying, let's say vaping, we're happy to do that for you in collaboration with you. So you could support us. If you make a commitment to ordering those, we'll do it. We'll build it for you, because we know in the past when we build things for and create programs for other organizations, they get shared more broadly. It's not just that one organization or one region that uses it. It ends up being used across the board. So your needs are likely to represent the needs of other coalitions and regions and schools and communities. So let me know if we can work on developing something that addresses specifically your interest, and we could talk about that. All right, geez, awesome question. So I think unless there's nothing else, I'm going to say thank you for joining us today. Thank you for your questions. Thank you for spending time with us. Do check out our website, preventionpluswellness.com. Thank you, and God bless you for all you do for youth and communities, for families in your region. And if there's anything I could do to help, please don't hesitate to reach out to us at preventionpluswellness.com. Thank you, and have a great afternoon. Bye, everybody.